Hello and welcome to TVC News at 10. This edition features Flashback, a recap of stories that made headlines during the week, but first, today's news. And we begin in the United Kingdom, where the Coordinating Minister of Health and Social Welfare, Professor Ali Pate, has secured an important concession from a cancer treatment equipment manufacturer, Elekta, as part of President Tinubu's National Health Sector Renewal and Investment Initiative. Professor Pate made this known during a tour of Elekta's factory and corporate headquarters in Crawley as part of negotiations for enhanced cooperation in health infrastructure investment in Nigeria. Elekta is one of the world's foremost manufacturers of high-tech medical equipment and associated technologies in the area of cancer treatment and is desirous of partnering with the federal government to further enhance cancer care in the country.
This is in the context of our efforts to accelerate the affordability, availability of quality cancer treatment for all Nigerians as part of Mr. President's Renewed Hope agenda. With Elekta and with other manufacturers of cancer equipment, we're going to work with them closely to ensure that Nigeria gets the best possible deals in terms of cancer treatment equipment. I was very impressed to see the attention to detail, the quality of the product, the range of the products, but also to know that Elekta is willing to support us as we try to rebuild the flood-ravaged University of Maiduguri Teaching Hospital. University of Maiduguri Teaching Hospital was devastated, and in particular its cancer center, where the latest cancer treatment equipment that they had was flooded and made unusable.
Joining me now for more on this development is the Vice President, Medical Initiative for Africa, Consultant Family Physician, Dr. Agbo Ebuta. Good to have you on the news at this time. So let's get your reaction.
Thank you for having me.
To this development. Nice to hear you too. What do you make of this development, even as we understand that available reports show that about 72% of cancer patients in Nigeria pay for their treatment out of pocket? What do you make of this development? Do you think it will change anything?
Well, it will change a lot because we have to discuss this against the context that every year the federal government has said that at least 120,000 Nigerians develop cancer every year. And when you look at this, these patients will require some form of treatment. Half of the patients that get treatment will require radiation intervention. Now, radiation intervention is the use of high-intensity beam to kill, shrink, and destroy cancer. And a critical component of this type of treatment is called the linear accelerator. The linear accelerator has been around since 1960, for 67 years now. In the US, for example, they have 3,500 of those machines. The UK has about 350. India has about less than a little under 700. And the whole of Africa has only about 366. And guess what? Nigeria has only 13, because we just lost one to the flood in Maiduguri. And if you go by the estimation and the recommendation by international cancer societies, every country should have one machine per 188,000 of their population. So we should, going by 250 million Nigerians, have at least 1,256 machines. But we just have about 13 functional ones, meaning that we have only 1% of linear accelerators that we need in Nigeria. So Elekta is one of the foremost companies in the world. They are cutting edge when it comes to linear accelerators production. So this partnership with the Elekta will for sure increase access to some form of their interventions in the form of provision of these equipments, software, and all forms of training that will increase the capacity of the government to serve Nigerians who unfortunately will be diagnosed with cancer. So to a large extent, it will provide that service. And if you listened again, the minister was talking specifically about University of Maiduguri, which has just lost one fabulous linear accelerator machine. So a first step will be to replace that machine, which will take care of our brethren that are living in the northern eastern part of Nigeria. So it's an agreement and an MOU that would help significantly to assuage the sufferings of patients and their families who are diagnosed of cancer. It will reduce the travel time, because even if we have about 13 machines, linear accelerators in Nigeria, most times over 80% of these machines may not be functional. So you have patients traveling from one end to another. So the first thing it will do for the people in the Northeast especially is that it will reduce the cost, the risk, and the travel time spent in search of radiation therapy, which is critical for the treatment and cure of cancer.
Yeah, well said in that regard. But, you know, I understand that under the National Health Insurance Scheme, cancer care isn't covered. Does this mean that this will be looked into? Because, for instance, right now, like I mentioned earlier, about 72% of Nigerians who have breast cancer don't have access to cancer care treatment. So is the federal government looking in that regard to ensure that cancer treatment is also covered under the National Health Insurance Scheme?
Yeah, I do believe that the federal government is exploring that. But again, we need to remember that just like you pointed out, 71% of Nigerians are paying for care, what you call out of pocket. So they don't have any form of insurance cover. And presently, the National Health Insurance Authority has put out some values that about 19 million Nigerians are now covered. So we still have about 210 million Nigerians that are yet to be covered. And their new target by the year 2030 is for 40% of Nigerians to be covered. That will put it at about 90 million Nigerians. Again, less than what we would desire, because if you compare us to countries like China, China has an insurance cover of 95%, and Ghana, just by the corner, has a cover of roughly about 60–70%. So we need to look at increasing the number of people under insurance cover, and then discuss the next phase of bringing as many other treatment, including cancer treatment, under cover. But the challenge, again, like I pointed out, is that in terms of linear accelerators, we have only 1% of the number we need. We need 1,256 linear accelerator machines. We just have 13 machines at the moment. So we need to increase that number, and then we can then discuss incorporating it into insurance and a lot of other things sustainably.
All right, beyond all of this now, your expectations from this partnership, especially in the area of building local expertise and, of course, reducing our reliance now on foreign technology in the health sector, what are expectations?
Well, my first expectation is that we would have a closer access, because once you have a handshake across the Mediterranean, and you have it directly with the producers, it brings you closer to the table, and you can discuss the terms, you can discuss partnership, you can discuss the future. So to a large extent, we can discuss cost, we can discuss a payment plan that will allow for some form of flexibility that would not put too much pressure on the government expenditure and all of that. And instead of maybe paying outrightly for one machine, we can negotiate for a higher number of machines, spread the payment over time, and increase the access for our people. So basically, the whole fact of having that discussion, having an agreement, and saying we are in some form of partnership means that Nigerians will smile, provided everything is done right.
All right, and let's hope for the best in this partnership. Thank you so much, Dr. Agbo Ebuta, Vice President, Medical Initiative for African Consultant Family. We appreciate your insights on the news at 10 tonight.
I appreciate it. Thank you for having me.